So I find it interesting as an ENT because I have, as a patient, have been to an ENT before, and never was I asked because as a kid, I grew up with a lot of sinus and ear infections, and I never was asked about the connection between my environment. I was always just given usually an antibiotic to treat like swimmer's ear infection. So how did you come to find the correlation between your environment and sinuses?
Well, it's kind of a long story, but when you're in training, you're only seeing patients in one subspecialty area for about 3 months. And so you get a skewed view of reality. And what you're taught to do works for most patients. But when you get into practice, you find out that some of these things that you were taught does not work for everyone. And there are people who remain sick. So we had a gentleman who was always sick. He had purulence running out of his nose no matter what you did. We did steroids, antibiotics, surgery more than once, and steroids, and allergy shots and medications and irrigations. And it didn't matter what we did, it didn't work. And so one day this person came back in and he was totally pristine clear. And I'd never seen him like that. And I'd been seeing him for about 10 years. And so I asked him, well, you're totally well now. What have you been doing? I know it's nothing I was doing.
Mhm.
And he said, well, we went to the beach for 2 weeks on a vacation. And I felt a lot better. So then I knew it was environmental. And then we figured out shortly after that it was mold.